So welcome to the Pathology Mentor platform. So today we will discuss about what are the options available after the MD Pathology and graduation in pathology. So I am Dr. Asif Balian, consultant histopathology with 8 years of experience in this field. So today we have Dr. Raman Arora with us. Dr. Raman Arora is a distinguished FRC path pathologist with 19 years of experience, and he has an impact across diagnostic excellence, laboratory innovation, and medical education. He is bridging UK and Indian pathology standard through his unique training journey from AIMS, New Delhi to UPMC Institute, Pittsburgh, and Royal College certification. He has trained 30 plus pathologists and technicians while developing standardized education protocol that systematically elevate the diagnostic accuracy. He is an enable assessor, and he is striving to raise quality standard of various labs. And now I would like to ask some question from Dr. Raman Arora. So welcome Dr. Raman Arora. Yes. So
Thank you,
what
Dr.
do
Asif,
you
for the kind introduction.
so I have a question, the first question for you. What do you think are the possibilities after finishing MD pathology?
Yeah. First, we need to assess what is a self-assessment, I call it. You need to understand what you want to become. You want to become an entrepreneur, you want to become a histopathologist, hematopathologist, or a clinical pathologist, or a quality enthusiast, or a computational pathologist. Now, if you're able to decide, then let's start working towards it. So, yeah, Dr. Asif, I think that solves your query. What else would you like to ask me?
Yes, yes. So you said there are entrepreneurship option after MD pathology. So how do you go about setting up your business, like small labs or the large labs?
See, first you have to understand there are two types of labs. So first you have to understand what type of lab business you would like to enter and how are your finances. Before you plunge into the business, you need to gain some experience in this field. But remember, getting into senior NC will not answer this, will not give you the kind of exposure you need. So you need to be a part of the lab which does the kind of work which you aspire to open up the lab. Now, when you've decided, the lab business is broadly divided into two parts. One is a high-end lab with everything under one roof, and a basic clinical path and hemato lab, which is outsourcing all type of the high-end test. A high-end lab test would definitely be an expensive affair and would need more resources. This would not involve hiring highly trained manpower, doctors, technicians, sales force, but also an expensive capex. In the above scenario, it is not possible to get adequate samples to keep the ball rolling with one center. Multiple collection centers or multiple labs are required to tie up with the major hospitals. A basic cash in your pocket. So you need a high-end lab would definitely be an expensive affair and would need more resources. And this would only involve hiring highly trained manpower, doctors, technicians, and sales force. But it is an expensive capex you'll have. In the above scenario, it is not possible to get adequate samples and keep the ball rolling. You have to enroll with multiple collection centers or multiple labs, or you have to tie up with major hospitals. For example, if you see core diagnostics, which is only offering higher end tests, it cannot get samples from one area. It has to have multiple setups or multiple collection centers or have multiple tie-ups with different major hospitals. Then if you are looking for a basic lab, it is more of a simple affair. Look out for cheaper rental options, and you need to take a decision whether you want a fully automated lab or a semi-automated lab. And the game more revolves around the cut business. But you have to be open to this. You have to understand without the cut business, you cannot run your business. So, and even with minimum earnings, try to do plan for quality work. Learn about the QC practices from well-functioning lab. Do not cut corners. This is my advice to all of you. Please don't cut corners when you open your own lab. Initially, for a year, you should have the resources to run the system without digging out profits. And journey of an entrepreneur is very difficult. You have to understand that the survival of the standalone labs in the era of so many corporate labs is difficult. Some things which can help you is being a game changer by getting an enable certification, at least into the entry level is required. I'll give you an example. Suppose there are three labs. One is owned by you, and one which is non-enable, and one is a part of an enable certified corporate lab, and other one is enable lab in a local place. Where would you like to give your sample? Definitely, your answer would be I would like to give my sample to a lab which is a chain of a enable certified corporate lab. But if you are in an area where you have an enable lab, and you have a good PRO business, you know people around, then you can be a winner over there also. But without enable, it becomes very difficult to run a lab nowadays. Now, Dr. Asif, I think this solves a query about how to become an entrepreneur. I've discussed about the different labs which are available, pattern of working of the labs, what you all need to have. So anything you all would like to ask about further on?
So definitely, doctor, you discussed very well about both the settings like the small lab and the large labs, and you also talked about the hurdles and what are the scenarios in the market. So now, if you apart from the entrepreneurship in the field of pathology, so we have now, some of the pathologists want to gain, knowledge and the expertise in a specific field of the pathology. So we have when somebody wants to plan enter in histopathology field. So what he or she will do in future or in the meantime, like after the MD pathology or some senior residency.
Yeah,
So
it's a
kindly
nice
give some
question.
insights on this.
Yeah. Dr. Asif and all my audience, you need to understand you cannot do histopath and cytopath unless until you have a good experience in a good academic institution or a center with a high throughput, which is necessary. Okay. Or either you can go for DM in histopath or fellowship in oncopath. This will give you a experience when you can practice histopath and cytopath. Minimum, the sample load of a histopath lab should be around not less than 15K to 20K per year, and cytopath not less than 35 to 50K. The lab should have sample processing in-house, that is tissue processing in IHC, which is now become a norm now. And conventional cytology and liquid-based cytology both should be under one roof. Having a molecular setup will be an added advantage. So you can plan in this way. But before you enter the seniority, please be sure that if you want to be a part of medical college or a corporate world, you have to decide upon that. Suppose if you want to go into a medical college after you finish your seniority, then you have to look for you'll have to look for places which give you teaching experience also. The medical college would require a teaching experience of minimum 3 years, and this varies at different medical colleges. And please don't directly enter into a super specialized fellowship like hepatopath or renal path. One thing we have to understand in India, very few jobs are available for super specialized work. And if you enter directly into super specialized, it becomes very difficult because you're not at all exposed to the general path. So being a histopath, you have to also remember the learning has to go on continuously. Be prepared to be sitting on the couch, reading or seeing slides. Once you have gained a good experience, now you can go for super specialized fellowships like renal, hepatobiliary, or neuropath. There's a good demand for candidates who have done renal path and they can solely practice this, but not for others. They can only go to specialized institutes like NIMANS where they can practice neuropath. Otherwise, first they have to practice general path. Along with the specialized training, they can report the cases. And once you gain enough experience, you can also move towards doing FRC path. Like I have done my FRC path part 1 and part 2 and even did my GMC also. So basically FRC path has two parts, part 1 and part 2. See, but remember, these both exams are expensive exams. So you have to be really prepared to answer them. And moreover, not only expensive, they're very grilling exam. You need to prepare a lot to answer them and clear the exam. And minimum it will take you 2 to 3 years to finish both parts, FRC part 1 and part 2. Part 1 is composed of 125 multiple choice questions, which is a mixture of one best and extended matching formats, which is everything is available on the RCPath site. where you can have a look. And basically, they are all are MCQs with different patterns. And the exam is of 3 hours. But the best thing is you can answer from India. And sitting at your home, you can answer the exam. But the part two is the one where you need to go and answer at a center. And please remember, India is not a center still. And it is held twice in a year. And you need to visit the RCPath sites. And minimum 6 to 7 months are required. And expert guidance is needed. And it is a practical exam which will be held for 2 days. And it has 6 components. Mentoring is mandatory. A separate session will be held by me. If you want to enter that FRC path, then you can have a separate session from me, which I'll be holding in future, which I'll be announcing. So these are the things which you can do after if you plan to go into histopath and cytopath. And there's one more thing. Suppose you want to go for DM also. There are 6 seats which are available for DM histopath. With the experience, if you say it is equivalent to doing a seniorship from a good institute and from DM, only DM you are more into academics. You have papers, then you have a thesis also. So your experience-wise, both are equal, except for DM histopath gives you more academic answer to it. But if you go in the market or the corporate world, both are almost at par. But in DM, if you do in DM histopath, you can go to good academic institutes after. Okay. Then there's one more option for DM also, which I'll be discussing more with Hemat. But as I talked about DM, you can go for DM hematopath also. It is available under the branch of DM hematology, which is actually a clinical branch which you can practice clinical practice after that. And but there are numerous fellowships also for hemat and non-hematology are available, which you can go for. And there, once you are doing histopath, remember it is always a learning phase. So you have to enroll into some courses which make you apprise of the new things which are coming up, because every day something or the other is coming up. So you can get registered for some courses, like good courses in gastropath or good courses in hematopath or hepatopath, so which are available online. And as we move on, we'll be starting also these type of courses. So this is what, if you want to do histopath and cytopath, this is the best way forward. And rest all, best of luck. Yeah. What, Dr. Asif, I think this answers your question. And what else would you like to answer? Ask?
Yes, sir. Yes, sir. So, apart from like FRC path or in the super specialization like DM in hematopathology and histopathology, how can we upgrade yourself? Apart from that FRC path, and what type of short courses can you do and refer to
There
us?
are some certificate courses available which you can opt for. Like I told you, you can opt for a certificate course in gastropath, and it is under the comfort of your home. It is an online lectures which you can do. You can do hepatopath also, which is available online. You can easily do it. They are divided into 5 to 6 sessions, and you can have it. You can even get the recorded lectures also. You get even assessments also along with it. So all these things you can do. There are even courses available for cytopath, courses for female genital system, then male urinary genital. So all the different specialized courses are available as certificate courses. So which will apprise you with the new whatever the new techniques which are evolving and the new methodologies of diagnosis are available, that will apprise you of that also. So this is the way you can keep on training yourself and keep on looking at the slides. That is the most important. And keep on reading and keep on enrolling on all these courses, which will give you an insight into all these branches. Yep. Yeah,
Okay.
doctor.
Yeah, thank you, sir, for this insights in the certificate courses. So, next question for you: what are the advantages and disadvantages of like DM histopath or the fellowships in different type of speciality like renal path, gastropath, and other?
Yeah, actually, I already told you renal path is the one where after doing a renal path, if you do a good fellowship, you can directly practice renal path solely. But the rest of the ones, like if you do hepatobiliary or GI path, you need to practice general path along with your specialized field. And moreover, if you do hematopath or maybe basically you do a DM histopath, you can enter into a good academic institutions like PGI or AIMS as faculty. So that gives you an edge over a normal MD Path student. So these are the advantages of doing DM. Otherwise, if you land into the corporate world, your experience counts more than your degree. So if you're more experienced and you knew how to handle the cases, that will be enough. So basically, if you want to move into good academic institutions, DM will give you an edge. But otherwise, if you have good experience from a good institute and you have a DM from a good institute, they almost stand equal in the corporate world. And but if you do DM hematopath, nowadays the trend has the corporate people are hiring in hemat, especially for specialized hemat, only people who have done DM hematopath. So this change has taken within these 5 to 6 years now. Yeah,
Okay.
Doctor.
So I have a question from audience, sir. Is there any option after MD pathology, like if we do any fellowship or DM in genetics or the molecular pathology, what are the options, available in respect of jobs and
See, yeah, for molecular path, the best institute if you want to do in molecular path fellowship is CMC Vellore. That has a very good, well organized fellowship for molecular path, and moreover, they every year they have a small short training program on NGS every year. So they do that. Otherwise, there are many good specialized or certificate courses available online, which will apprise you of the basic application of molecular path. And basically, when you enter a fellowship in molecular path, you are more you more work on the bench also. But if you, as a pathologist, actually you need to be more apprised of what is the application of molecular in day-to-day practice. Suppose you get a case of maybe a CA ovary. So you need to know that what are the molecular tests the clinician need to order and how to interpret them. And you can help your clinicians also out of it. And moreover, if you have a knowledge about molecular path, you can also guide the clinicians that they need not ask for NGS for everything. For some of the cases can still be managed by PCR. And many times when these are outsourced, what will happen sometimes you get a result which the clinician fails to understand. You can make them understand what is the why this false positive has come, what is the use of false negative, what should, suppose if a clinician orders the NGS, how much should be the resolution. So all those things you'll be able to answer if you are able to undergo some specialized certificate courses. But if you want to pursue as a career, then you need to do a fellowship in molecular path, and the best place to do is CMC Vellore. Even SRL was doing sometime fellowship at Mumbai, but I don't think now it is being continued. So the best place which you need to go into it, they have even fellowship in cytogenetics also. I know quite a number of pathologists who have done fellowship in cytogenetics and fellowship in molecular path. So you can have a look on that. And even the Tata Memorial Hospital, Kolkata has fellowship in molecular path. So these are the places where you can look for fellowships in molecular path and cytogenetics.
Okay,
Yeah.
so one more question about the molecular pathology. What are the career options in molecular pathology after MD path?
See, Dr. Asif, the thing is, after doing molecular path, if you do, you can move to a places like genetics labs where they are doing high-end work on NGS or they are doing pyrosequencing or Sanger sequencing. And but it is not only a field of a MD path. You need to have good scientists along with you. So actually, if you go to see in the corporate world, but you will be able to use this molecular path more better than a cytogen or a technical staff who is trained into it. So the interpretation part will become more stronger when you enter into this field. So maximum the people who got trained from doing fellowships in molecular, they have been absorbed by the major good institutes or the academic institutes. And some of them have got absorbed in very good genetics labs who are having good load of genetics over there. So what they do, when they have entered now, the clinical aspect of the molecular has become now strengthened more than what it was 4 or 5 years back now. So this is the change which has taken place now. This solves your question, Dr. Asif?
I think I have all the questions which asked for you. And in the participants or the audience, do you have any specific question related to the career option or the options after the MD pathology? So you can ask directly to the Dr. Raman.
Please be free to ask me whatever you feel like.
So I received a question in the message chat box. Is there a saturation in the pathology field after the MD?
See, as such, if you ask me,
And how to cope up with it?
see, whenever I go for hiring good people in my department also, I face a lots of difficulty because maximum of the pathologists whom I are able to, they have not been properly trained in good places. So that's why I'm telling, if they want to enter into histopath, you have to train yourself properly, and more and more new options are opening up. When I passed my MD, that time only hardly any corporate hospital was available. Now, if you go to see, so many medicities have come up. Like Medanta has came up when I was around 8 or 9 years back. Now, new Yashoda Medicity has come up. So these things are coming up. If you ask me, matlab, the opportunities are increasing. New corporate labs are coming into, and we definitely are a growing population. The need for path will go up, but you have to keep yourself abreast with the new things which keep on coming. Like for example, AI is coming in our fields now, so you have to keep abreast of the new things which are coming up. And one thing which I forgot to touch upon is about computation path also. So please try to learn something about computation path also. So keep yourself updating every day, then only you'll be ahead of all this. But if you move into a routine clinical hemat lab and you stop learning, that is the time then you'll face problems in your career. So we have been moving so many years now. Initially, when we also finished, we've heard that MD path is already saturated. There'll be no options. Touch wood, we have been moving quite uh, swiftly in our careers now, and we have been quite satisfied with whatever we have been doing. Initially, there was a time there were hardly places to work on histopath. Now there are so many places, even in the smaller places. Now histopath has come up. Recently visited Patna. Even Patna has places where they are doing good IHC workup, which was not there 8 or 9 years back now. So things are coming up. So everywhere, but you have to be ready to move to different places, learn new things. So please keep abreast with the new techniques. Please keep yourself updated with the new WHO and keep on learning new things every day. So then only you can be well versed with histopath and cytopath. For hematopath, I'll say if you're doing advanced or like techniques like flow cytometry or molecular, then it is different. Otherwise, if you're doing routine clinical hemat, please don't become a machine pathologist. Just by pressing the button, please don't stop approving your reports. Look at the slides properly. I'm still saying there's a dearth of good clinical hematopathologists available in our country. Most of the time, what happens, the clinician orders a test and the pathologist just runs in and pushes it out. Please stop doing this. Put yourself in seeing the slides properly, learn more and more every day. Until you learn and try to give more inputs to all whatever you get in your lab. So once you start giving this, you'll start enjoying, and the more the opportunities will keep on increasing. Please don't worry about the machines. Machines are just helping you. They are not stopping your pathway to success now. Yeah, that's.
Uh, I think uh, I think that's all. We have one question as question also about the computational path. So Dr. Priya asked the what it is, the computational path.
Uh,
So
yeah, yeah. I think Dr. Asif, you'll be the best person to answer this because you have been moving in this area more than me. So I think that will be a more insight from you than rather than from me.
yeah, thank you, Dr. Raman sir. And so basically, the computational path is a branch of pathology and some kind of, the AI and the computer involved in the pathology reporting and processing. So in computational path, we have too many, further branches. Like first branch is like we can review or the second opinion to the case from the remote area, like our rural area in India. And the other is how to train the machine, the pathology, the pathology grading system, KI index, IHC reporting. That is also a part of, computational pathology. And the third is how do we analyze the slide for tumor or the non-tumor area? Like we have a scanned slide in our computer. First, we like on the microscope, we go to the tumor area, then we see the morphology and the further identification of the histopathology, like necrosis, what are the pleomorphism, anaplasia, like that. So, what computer did save our time? Like it will divide the areas like tumor and the non-tumor area automatically. This is the basically the solution in computational path. Though there are so many other field in the computational path which will be open in India in future. But nowadays, some of the premium institute like the PGI Chandigarh and the AIMS and some of the institute like CMC Vellore, they are doing remote reporting and the second opinion reporting on the computational pathology field. So that's all I think for this field. So anybody has any other question related to the career option or the other, the field we choose after the MD pathology, where we go, where we land up? So I think we can close the session now. Audience does not have any questions. So thank you so much for the participation, and thank you so much, Dr. Raman, for the wonderful session and the insights about the MD pathology and further, career options and the options available in, in this field, specifically in the pathology.
Yeah.
Thank
Thank
you
you,
very
Dr.
much.
And thank you, participants, for it. Thank you.
Thank you so much.